Welcome back to the Medicoverse channel, where we talk about everything medical, science, and the in-between. With flu season coming upon us, I figure it would be a good time to touch base about how bacteria and viruses are passed among us. In simple terms, the cycle of infection refers to how infections are transmitted and spread among individuals. It involves several stages, and understanding this cycle can help us prevent and control the spread of infectious diseases. Here's a breakdown of the different stages involved. Reservoir. The cycle typically begins with a reservoir, which is the source of the infectious agent. Reservoirs can be humans, animals, or even the environment itself. For example, a person infected with a virus can serve as a reservoir. Portal of exit. Once an infectious agent is present in a reservoir, it needs a way to leave the host and enter a new susceptible host. This is known as the portal of exit, which can vary depending on the type of infection. Examples include respiratory secretions like coughing or sneezing, bodily fluids, or even insect bites. Transmission. After leaving the reservoir, the infectious agent must find a mode of transmission to reach a new host. There are different ways of transmission, including direct and indirect contact, airborne transmission, vector-borne transmission, through insects, and more. For instance, certain diseases can be transmitted by touching surfaces contaminated with the infectious agent or through respiratory droplets in the air. Portal of entry. Once the infectious agent reaches a new host, it needs a portal of entry to establish an infection. This can be through inhalation, ingestion, contact with mucous membranes, or breaks in the skin. For example, respiratory infections often enter through the nose or mouth. Susceptible host. Not everyone exposed to an infectious agent will become infected. A susceptible host is an individual with characteristics that make them vulnerable to the infection. Factors such as age, underlying health conditions, and immunization status can influence susceptibility. Establishment of infection. If the infectious agent successfully enters a susceptible host, it can then establish an infection. This involves the agent multiplying and spreading within the host, potentially causing various symptoms and health issues. Shedding and transmission. Once infected, the host may shed the infectious agent, meaning they can transmit it to others. This can occur through various means, such as respiratory droplets, bodily fluids, or even through vectors like mosquitoes. Understanding this cycle helps us identify points at which we can intervene to prevent the spread of infections. There are several effective ways to stop the cycle of transmission and prevent the spread of infections. Here are some important measures. Practice good hand hygiene. Regularly washing your hands with soap and water for at least 20 seconds or using hand sanitizer with at least 60% alcohol content can help eliminate many harmful pathogens on your hands. Follow respiratory etiquette. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing to prevent respiratory droplets from spreading in the air. Dispose of used tissues properly and wash your hands afterwards. Maintain physical distancing. Keep a safe distance of at least 1 meter, 3 feet, from others, especially if they are coughing, sneezing, or not feeling well. This helps minimize the risk of respiratory droplets reaching you. Wear face masks. When in crowded public spaces or when physical distancing is challenging, wearing a face mask, especially one that covers both your nose and mouth, can reduce the transmission of respiratory droplets. Vaccination. Stay up to date with recommended vaccinations. Vaccines help prevent many infections and can significantly reduce the risk of severe illness or complications if you do get infected. Stay home when sick. If you're feeling unwell, with symptoms such as fever, cough, or difficulty breathing, it's important to stay home and avoid close contact with others. This helps prevent the spread of the infection to those around you. Clean and disinfect surfaces. Regularly clean and disinfect frequently touched surfaces, such as doorknobs, light switches, and countertops. This helps eliminate any pathogens that might be present on these surfaces. Practice respiratory hygiene. Encourage proper respiratory hygiene among others by promoting the use of tissues, providing easily accessible hand hygiene facilities, and promoting coughing or sneezing into elbows rather than hands. Follow public health guidelines. Stay informed about the latest guidelines and recommendations from local public health authorities. They provide valuable information on preventing the spread of specific infections in your community. Support contact tracing efforts. If you have been in contact with someone who has tested positive for an infectious disease, cooperate with contact tracing efforts by sharing information with health authorities. This helps identify and notify others who may have been exposed. Remember, each of us plays a crucial role in breaking the cycle of transmission. By practicing these preventive measures, we can protect ourselves and others from infectious diseases. That's all for today, folks. Don't forget to like, share, and subscribe to see more awesome content. Practice good hygiene, and as always, stay healthy. Thanks for watching.